Good evening, and thank you very much for joining us tonight. My name is Joel Torres, and I'm the Senior Manager for Family Connections Adapt Coalition. We will be starting shortly. Just a few housekeeping tips for everyone. Uh, we will try to get this through this as smoothly as possible. Just ask you to please mute your microphones. We are recording this webinar so that we can pass it on to the rest of the parents who cannot attend tonight. You can feel free to use the chat box if you would like to ask any questions. Of course, there will be an open question and answer session at the end, but if you have something that you don't want to forget, you can, of course, put it in the chat box. Uh, During the question and answer session, we will cut that from the full recording itself, just to respect everyone's privacy and not having your voice or your video on that particular portion of the presentation itself. But just wanted to put that housekeeping right up front. The chat box and the chat feature is available to you, and we are ready to go. So we welcome you to this presentation in collaboration with West Orange High School. Before we officially begin, we want to give our partners an opportunity to say hello. I know that we do have Mr. Amadeo and Ms. Jacqueline here, and I did not want to put them on the spot, but I wanted to respect and appreciate their leadership and their support in making this possible. So I wanted to see if they wanted to, they can definitely unmute themselves and give a quick welcome for us tonight.
Yes, good evening, everyone. This is Mr. Chiricello from West Orange High School, one of the student assistance counselors, and we're very excited to be in collaboration tonight with the ADAPT Family Connections and bringing this presentation to our family and communities. So we're very excited to start and hope everyone has a great experience. Thank you.
Thank you very much. And Ms. Jackie, you might be still connecting to audio, but if she jumps,
it sounds like she's still having a technical issue.
not a problem. If she hops back on, we can give her an opportunity as well to just say hello.
Yes, thank you.
So once again, we are very grateful to be here. I will be presenting tonight with my fellow coordinator here from ADAPT, Julia Reboredo, who will be joining us as well. So just give us an opportunity real quick to show you what this presentation will look like here. First and foremost, we'll just explain who we are as far as your presenters, give you some background knowledge of our coalition, what we've been doing here in Essex County, some background information about current drug trends on vaping, marijuana, and other drugs. We'll discuss some prevention strategies that you can use, very simple prevention strategies that you can use, and then have a question and answer session related to what we've been talking about or any other questions that you might have related to substance use prevention. So before we begin, of course, just a little bit about us. I'm going to pass it real quick to my coordinator, Julia Reboredo, so that she can introduce herself, and then we'll continue with the presentation.
Good evening, everyone. My name is Julia Reboredo. I'm one of the ADAPT coordinators for Family Connections. It's been a pleasure working with the coalition, and I hope that we're here bringing the best education for your children.
Thank you, Julia. And once again, Joel Torres. I am the senior manager here for ADAPT. I've been here for 9 years, going on 9 years now. This will be my 9th year in March. I have a bachelor's in public health, a master's in public relations, public and organizational relations, and I am a master certified health education specialist, which basically means I've been working in the public health realm for over, like I said, 9 years now, working in the substance abuse prevention area, but working throughout all of health and wellness as well. Our coalition is first and foremost a part of Family Connections, which is a nonprofit organization that has been around since the 1800s, actually, here in Essex County and throughout all of northern New Jersey. We're a coalition that's focused on preventing and reducing specifically underage drinking prescription medication misuse and abuse, and tobacco use by minors. And we're also looking to prevent and reduce substance use disorder here throughout the partnerships and the work that we're doing. We have some amazing work that we do with our youth leaders and with our community partners and with our community members who are coalition volunteers or members here at ADAPT. We build collaboration, we work on the realm of prevention, and then also we look at the overall health and safety of individuals here in our county. And this is just to give you a brief background, so we're not going to go too into the weeds here. But if you want more information, of course, during the Q&A, we can give you some more details of what we do in the community itself. Like I said before, we're a group of volunteers. So except for the staff that we have here on board, the rest are volunteers that are working. And we work in committees that work together to create the ideas to change policies and programs and work on decreasing substance use disorder here in the county. And specifically looking at youth access to drugs and alcohol. What are those access points and how can we work together to reduce those risks and increase protective factors and support that happen? As I stated already, we're managed by Family Connections. We are funded through the New Jersey Division of Mental Health and Addiction Services and through the National Office of National Drug Control Policy as well. So thankfully, we started with a small grant from the state and we've been able to expand that to have funding from both the state and the federal levels as well. Most of this I've already explained, but the one piece I'll talk about is what you see in the very last square, which is the fact that we follow what's called the 7 strategies for community change. That's looking at the fact that we can start as something as simple as giving you a brochure with information. But quite honestly, if we just stop it there, we're simply just telling people, hey, we did a great job. We gave you a brochure, but we're not really looking at how we can help you and help the community make longer term changes. So we start with providing information. The brochure is very important. The information is important, but we want to go deeper into that. We want to make sure that we enhance your skills. We provide support. We change consequences in the area, and we look at in the long term modifying and changing programs and policies, because most importantly we're not here to just say, hey, we have grant funds, hey, we spent the money on this. We want to look to long-term changes that will really benefit our community. As I stated before, our coalition members work in committees. At this moment, we have 4 very active committees that work in various areas. Our underage drinking committee focuses on planning and implementing the underage drinking prevention initiatives that we have. Some examples include a sticker shock campaign where pre-COVID times, of course, because everything's changed, unfortunately, in the past year, we'd work with our youth leaders and with our law enforcement partners and go into local businesses, either liquor stores, or mostly liquor stores, to on boxes or on any packages of alcohol, put stickers that give a message of making sure that you're not purchasing this item for an underage individual. From there, we had mandatory responsible beverage service training ordinances where we work with our local towns to implement a law that makes sure that the staff members who work in bars and restaurants are constantly trained on ways to reduce youth access and reduce over drinking of alcohol in those facilities. Along with that, we have our prescription drugs committee, similar focus, but only on prescription medications. We've increased the number of permanent medication sites. So in West Orange, at your local police department, you're able to drop off any old or unused medications right there at the police department, no questions asked. That's one way to dispose of your medications and make sure that they're not just in your home. All the way onto doing a wellness initiative senior education program with our older adults that we do a 6-week program with them. From there, we have a committee focused on the interfaith community and expanding our relationships and substance use prevention efforts with our faith-based communities here in the county. And last but not least, our newest committee was the LGBTQ plus committee, where we're looking at supporting and increasing prevention initiatives and resources for our LGBTQ plus community here in Essex County. And finally, when it comes to just a little background, just so that you know, we follow a scientific process. So we follow what's called the Strategic Prevention Framework Model. The simplest way to put it is that we start by collecting data and making sure that we're not just saying we're going to do this in the community because we think it's a good thing to do. As you're here today, we have some data, some information, some knowledge. We start with that data. come into our local communities and do focus groups, do some more data collection, do some key informant interviews, and make sure that what we're really looking to target is happening in our areas. From there, we build capacity, we build relationships, we start planning, implementing, and evaluating the services. And all throughout, we're making sure that we're staying sustainable and that we are being culturally competent to the communities that we're serving. So that's the overall gap of looking at who we are and what we do. With that, I'm going to pass it on to Julia to start with the background information about the actual current drug trends that we're seeing here in the county and nationwide as well.
Thank you, Joel. I will be discussing about the background information and current trends, such as vaping, marijuana, and other drugs. Next slide, please. Working through the gate, through the haze. Before we begin, I just want to share important information. As Joel previously mentioned, there's a survey that has been going on. It's a national survey from 2020. It stated that 21% of tobacco use products were used by high school students. However, many cases involving youth are informing that initial introduction into using nicotine and marijuana are used by high school students. This is the survey actually that was passed on last year, 2020, where 21% of the current products are used by high school students. As you can see in your screen on the right side, we're sharing that tobacco product was used about 23.6%. E-cigarettes had as 19.6%. Cigars were used about 5%. Cigarettes, smokeless tobacco, hookah, and hosted tobacco products. Next slide. We're going to review about the vaping products. As we know, the vaping products started being sold in 2006, and they haven't been given different names, from vapes to electronic nicotine delivery system, known as ENDS. Next slide. We're going to start with electronic cigarettes. You can see they're very similar to an e-pen. They're very similar to the normal cigarettes. These products have liquid inside of them, which then evaporates into smoke or vapor. Some can be rechargeable, disposable, or refillable. E-cigarettes were the original version introduced back in 2006. They used the name because the product resembled the classic cigarette. Next slide.
Thank you, Julia.
We have the electronic nicotine delivery system. You can see on the left side of your screen, there are different forms, which these industries have been trying to elaborate different products. Different companies move away from the classic cigarette that look and use different names to promote their products. Different categories now include the original e-cigarette, but also vape pens, hookah pens, tank mods, JUUL, and etc. They're originally designed to deliver liquid nicotine to users in the form of vapor rather than smoke. The vapor also comes from heating liquid nicotine and flavoring. Next.
Thank you. And just to note real quick, as Julie was stating, a couple quick things. First and foremost is that these products, or these electronic smoking devices, as we call them, were first and foremost promoted as a safer alternative to smoking for individuals who were addicted to nicotine. That was their initial promotion of it. But as we're seeing, as the data is showing, a lot of our younger individuals, their introduction into using nicotine products or now liquid marijuana products are these electronic smoking devices. And from the data, we were very excited when we were first starting here at Adapt, when we started seeing the number of cigarette use decrease amongst youth. And then all of a sudden, there was a big boom where the JUUL product came out a couple of years ago, and just the number of e-cigarettes and electronic smoking device use just skyrocketed. When it comes to the term vaping, vaping is a term that many people are using now, especially our youth, to describe electronic smoking devices. Now, one hesitancy why when I present and when we present, sometimes we use a electronic smoking device. I'll explain that in a little while. But vaping, when you look on YouTube, when you look at the information, vaping is discussed as a positive trend. So when you're searching for information on vaping, you'll find data, but you'll also find videos of how to increase your vape cloud, how to increase your usage of the products itself, how to modify your device, and things of that nature. So that's why we use a different terminology. Some of this is due to the social media aspect of things. So, of course, the more that folks use it online, the bigger that it spreads, and the bigger that positive reviews are out there about the products themselves. When it comes to using the term electronic smoking device, one reason why we like this term itself is because, first and foremost, you'll hear electronic nicotine delivery system, which some of the products are. But a lot of our young individuals now are using these products not just for nicotine, but also for liquid marijuana. And we'll get into that in a little while. But along with that electronic smoking device, you include the word smoking, which with that, you can have a discussion about the fact of these products have other chemicals and other substances within them that are not just water. Because still, even with all of the information, even with all of the truth campaigns that you're seeing out there in TV and online, there's still false assumption by some young individuals stating that the products only have water vapors and that they don't have anything else within them. So that's why it's important to just look at the terminology that you're using when you're discussing these products. When it comes to the actual trends, we're seeing a very sharp increase, and we'll talk a little bit more about the pandemic and how that shifted these numbers and how that's a good thing. But looking back and starting in 2014, we started seeing that these devices were the most commonly used tobacco products amongst our middle and high school students. It started in that year with only 9.5% of eighth graders, up to 16.2% of 12th graders reporting. And within those numbers, you can see how they varied in 8th, 10th, and 12th grades. Now, this is self-reporting, of course. So we can't say with 100% certainty that the number might not be higher than that. But this is the self-reported data that we have available. Now, when you look at just 3 years later in 2017, the number of high school students that used the products in the past month increased. So in 2014, it was the most commonly used product. But then in 2017, we started seeing that 11.7% of our high school students were using these products in a month, in the past month. Now, of course, the data decreased into looking at how long within that month or how long have you been using. But that number spiked in those years. If you look at just a 1 year change between 2017 and 2018, we started seeing that over 3.6 million of youth stated that they were currently using these products. And that number increased to 4.9 million in 2019. So year after year, you see this increase of usage by our youth. The pandemic has shifted that, as I stated, but this is where we saw the trends going, and this was the concerns that we were having related to it. When it came to the use in high school students, there was a 75% or more than 75% increase in the use of e-cigarettes in our high school population. And that's just in 1 year, from 11.7% in 2017 to 20.8% in 2018. And of course, young folks attracted to the different flavorings of these products. 68% of the users have claimed that they use some type of flavoring in their products. Now, when we talk about this discussion and when we're having this discussion with our parents, with our youth, we're giving you this data not to scare anybody. The scare tactics did not work in the past, and they do not work now. This is just, we're giving you the data, and then we'll talk about some strategies so that we can look at how we can reduce this in our areas. So first and foremost, I want to be very clear of, we're not trying to scare anybody with these numbers and say, oh my God, these numbers are increasing all the time. What are we doing? It's more of just having a conversation of, this is the data. Now, what can we do to reduce it or prevent it from happening in the first place? when we look at the pandemic itself, it's very clear that there has been a decrease. And a recent study by the Journal of American Medical Association, just from this past year, saw that there was a sharp decrease. Almost 57% of youth stated that they changed the amount that they were vaping. 37% said that they stopped completely. 31% stated that they minimized their use amongst these products. And I'm going to pass it on to Julia to give you some more background on why we're seeing these decreases, or why we saw these decreases in 2020 due to the pandemic.
Thank you, Joel. All right. As Joel previously stated, we're trying to focus on the decrease that has been going on with the pandemic and how it has been altering the children, the youth, now that they're doing homeschooling. Joel, I'm not able to. There you go. All right. Now I can see it. All right. There is data from the survey found that the decrease in use could be related to some of the following. As we know, after the lockdowns, there's been a reduced opportunity to purchase products from local stores, meaning that the youth are not able to be outside and purchase these products. There has been also an increased family time that may reduce the stressors that led to the use of these products, meaning that parents are home, they're spending more quality time with their children. There's also an increase of fear of issues with their lungs, meaning that with the COVID-19 symptoms affecting directly the lungs, there's a fear that the youth do not want to use these products. Next. Next, we're gonna review what is in the products. What is this in this product? As you see, it's very appealing, the colors and the different shapes that these industries use. Depending on the type of the product used, the device might have liquid nicotine or marijuana. These are two ingredients that many of the users do not know. In addition, there are more than 15 flavors, including fruit, tobacco, menthol, mint, nuts, spices, coffee, tea. There are different flavors. And of course, the youth are very appealing. They use these products to relate to different trends going on social media. Next, we're gonna review what else is in these products. There is a liquid in these products, including the ingredients like propyl glycol, vegetable glycerin, diacetyl that is found in e-liquids with sweet flavors and flavor chemicals. Propyl glycol is a synthetic liquid substance that absorbs water. Propyl glycol is also used to make polyester compounds and as a base for de-icing solutions. Propyl glycol is used by the chemical, food, and pharmaceuticals industries as an antifreeze when leakage might lead to a contact with food. We can see the different causes that can damage the health in different children. Next, we're gonna review what are some of the health issues going on with vaping. This is a study that relates that there is a popcorn lung disease. The name is bronchitis obliterans, better known as popcorn lung. These first appear in workers who inhaled artificial butter flavored in microwave popcorn processing facilities, according to the National Institute of Occupational Safety and Health in 2000. Research shows that popcorn lung is caused by inhaling chemicals like diacetyl, which can scar your lungs. The symptoms for popcorn lungs are dry coughing, shortness of breath, wheezing, and feeling tired. And as you remember, these are the primary symptoms of COVID-19. Vaping-related lung injury. In 2019, the Center of Disease Control and Prevention, known as CDC, the United States Food and Drug Administration, and other clinical and public health partners investigated a national outbreak of e-cigarette or vaping product use associated with lung injury. As of February 18 of 2020, there is a 2,807 elderly cases associated with vaping products in the United States that have been reported to the CDC. Due to the pandemic, the CDC stopped collecting data related to Ebola.
Thank you, Julia. And just a quick little side note story related to this. So if you look at the fact of the federal government started in 2019 collecting data and information related to what they believe to be some type of lung injury due to their use of these products. What's interesting is that in, I'd say, 2014, 15, we had a focus group session with our youth leaders at that time. And it was very interesting because we were having discussions with young individuals from different towns here in the county, from Orange, West Orange, East Orange, Nutley. And one of the conversations, we had one young lady who was leading one discussion related to what's one of the biggest substance issues that you're seeing at your school and why. And I remember vividly this young lady from Nutley who spoke to us and said, you know, we have a lot of young kids who have these products. They're electronic cigarettes, and they think it's cool to blow the smoke in our faces in the hallway because you can't smell anything. And we've been talking about this since 2014, 2015 with our youth leaders and with our coalition. But it always, unfortunately, takes the government a while to catch up. Thankfully, 2019, they've caught up and they started doing some research around this. But as you'll learn, it unfortunately takes us a long time to look at the long-term effects. And some of the concern around these products is that they're still too new for us to know the long-term effects of them. So when it comes to February 18th, 2020, which, as Julia mentioned, is the latest that we have any data because the pandemic, when it comes to these type of injuries related to your lung, your respiratory system, you've got COVID-19 having taking over everyone's attention related to it. So there's not much time to be doing this research behind it. And also, along with that, you don't really know, was it this product or was it the fact that they had COVID-19? But as of February 18th, 2020, that was the last time we have this data. 68 deaths were reported in 29 states and the District of Columbia. The common link related to having this vaping-related lung injury is a history of using e-cigarette or vaping products. As Julia stated, some of the things such as popcorn lung is something that's prominent within its use itself, but also when it comes to vitamin E acetate, that's been identified as a chemical of concern when it comes to these products. And also the main ingredient that has been in many of the samples is THC, which we'll talk about in a little while, tetrahydrocannabinol, which is the main active ingredient in marijuana. So what that shows is that the liquid version of the product, not the liquid marijuana itself, maybe not the actual marijuana within the product, but that is also mixed with chemicals, and maybe there's some type of combination of those products that is leading to more of these reports with the individuals who are using those products. The astounding thing to find is that 79% of the patients who report this injury are under the age of 35, and the causes are not fully known yet because it's still new. So as we continue to do research, we'll continue to find out what are the long-term impacts of this usage. The CDC recommended back in before the start of the pandemic uh, that this product should not be used until more research can be done on it. As we stated earlier, this product was started to be promoted for individuals who are already using nicotine products, and it's an easier way for them to slowly stop using nicotine altogether. However, we're seeing that more young individuals are using it, and there's a recommendation to limit the usage for now. So when you look at why the fuss and why the big concerns about it, is that we I don't want to beat the same drum here, but the products are new. there's not much that's known about the health effects from using them. It took us 25 years to just find out the use of cigarettes and the damages that that causes to the body. Now, technology, science has advanced. So hopefully it doesn't take 25 years. As you're already seeing, we're getting data. But hopefully it does not take us 25 years to see the lasting effects of using these products. And based on what we know with smoking cigarettes, we know that nicotine and its addictive properties can also contribute to long-term use of these products themselves. And we'll get into some of the products, what they have within them, and what that long-term addiction possibility might be with these products. Finally, looking at, well, not finally, but finally with this area of why the fuss. Um, the pandemic is kind of showcasing to us the fact that we really need to take care of our lungs, of our respiratory system, due to the challenges that the virus has on us. And vaping can affect your lungs just as much as regular cigarettes can. The research is out there, the data is out there on what's within these products. So just because you're using a electronic smoking device does not mean that it is a safer alternative to using a regular cigarette for anybody who's currently using those the regular cigarettes or is trying to get off of regular cigarettes. And vaping can cause your brain to have developmental issues as well, such as focusing, concentrating, and listening. One piece before I pass it on to Julia is just looking at the JUUL. JUUL is the most popular product that we've seen used by our youth populations here in Essex County and throughout the entire nation. Just the use skyrocketed over the past 2 to 3 years. And what we're seeing is that these products look like a flash drive, so they're easy to conceal. You connect it to your computer to charge. And sometimes, if our educators, if our parents are not fully educated on these products, they think it's just a regular flash drive that a kid is using. Now, like other electronic smoking devices, it's a battery powered device. It heats up nicotine, a liquid that has nicotine within it, along with other chemicals, as was stated earlier. And that produces the aerosol that then you inhale, and it comes out as a vapor when you exhale it. It's one of the few cigarette products that uses what's called nicotine salts. So that allows a higher level of nicotine to be inhaled into your system more easily in an easier fashion, and you'll get less irritation of it. So what we're seeing is that a lot of young individuals are consuming these products a lot quicker and more often because they don't deal with the irritation of using the nicotine in your traditional cigarettes. And we've seen a lot of reports over the past couple of years of its usage increasing in schools. You see some schools that are trying to do different things to decrease its usage. Some things that we might speak to our partners and say, let's look at other alternative methods that we can use rather than looking at some of these draconian ways to handle it. And thankfully, our partners here in West Orange are very proactive with their work. And I believe you've heard a lot of the things that they've already been doing. So we love working with Jacqueline, with Amadeo here, because they are very proactive with the way they handle this issue and any other issues that come up that we can collaborate on, both positive and negative. But we've seen from JUUL, the beginning was JUUL with this type of product, and then it just expanded to where now we have what's called PAX Era, which is more of a focus on liquid marijuana within it. But the cartridges can be interchangeable. So somebody can buy a cartridge for one product that might have liquid marijuana and put it into their JUUL. So there are ways to adapt and change them. And with that, I'll pass it on to Julia to speak a little bit more about the addiction related to JUUL.
Thank you, Joel. And I just want to emphasize one comment that was dropped in the chat. Yes, these big companies really knew what is the population that they needed to target. As you can clearly see, one JUUL pod is equal to one pack of cigarettes. And approximately 60% of the JUUL users are aged between 15 and 24. They do not know what JUUL has and what contains, which is nicotine. There is some research find that individual becomes addicted to nicotine after using just 5 JUUL pods, which is equivalent to 100 or 200, between 100 and 200 cigarettes. And before the pandemic, when we used to, most of the ADAPT staff used to visit the schools, the high schools, and to provide education on prevention. And most of the youth, they did not know what was the product in the vaping and any tobacco. And it was very sad to hear from them that they had easy access to buy the JUUL in the stores. They're cheap. They come in different flavors, so why not to try it? Next, please.
Real quick, I just want to emphasize one thing that Julia just mentioned, and we're going to touch base on this in a little while when we talk about prevention strategies. But the most interesting piece of this is that we met with youth, in different schools and different areas, and we had these conversations. The the good part of it is that they were willing to have discussions with us and debates with us, and they challenged us and they pushed us back. Uh, and the issue is that sometimes when you do presentations, you're presenting from your viewpoint, your perspective. Sometimes you might add your bias. Of course, we work in the prevention realm, so we don't really want people to be using these products. So we have our own spin on it. However, the debates that came out of these conversations were they pushed back, and we pushed back with knowledge and information and insight. And it was good to have that debate because they realized, okay, well, you know what you're talking about. You're not lying to me. I can go on my phone and Google what you just said, and I could find out, oh, wait, okay, actually, yeah, this Vox article did say that one JUUL pod can equal 1 to 2 packs of cigarettes or 20 to 40 cigarettes. The CDC had reported that as well. There's research around it. So, okay, you're making sense to me. You're not just lying to me. So it was good to have that back and forth dialogue with the youth here in Essex County, because they need that. They need to see that you know your stuff, and that you're not just talking to them just because you are claiming to be an expert and knowledgeable about these things, but about the fact that this is factual information that you're sharing with them, and you want to move forward in a productive manner. And I think that's why we've been able to connect with a lot of our youth, and we've been able to have youth leaders as part of the coalition itself. So I'm sorry, Julie, I just want to
No
add that piece
problem.
in.
All right, next we're gonna go over marijuana and the cannabis plant. Marijuana is the preparation of leafy material from the cannabis plant that is usually smoked. This plant contains natural occurring compounds called cannabinoids. And here we go with the long name, which is the tetrahydrocannabinol, most known as THC. THC is the main active ingredient in marijuana, and according to the National Institute of Drug Abuse, acts like the cannabinoid chemicals made naturally by the body. We're gonna review the levels of THC in marijuana. Sinsemilla is the second most potent form of prepared marijuana and makes up to about 50% of confiscated marijuana in the United States. There's also a concentration of THC that varies based on the form of preparation. The first one is ganja, which is the tops of the leaves that contains between 3 to 5%. The second one is sinsemilla, which is without the seeds. It contains between 8 to 11%. And we have the hashish, which is the most concentrated plant form that contains between 14 to 16% of concentration of THC. Last but not least, we have the hash oil, which is the liquid version found in vape products that contain up to 60% of concentration of THC. And this is the most popular used by the youth and the vaping products. Vaping and hash oil. Hash oil is extracted oil from the cannabis plant. Oil has a higher concentration of THC, between 25 and 60%, which makes it much more potent than marijuana in plant form. This oil is also prepared liquid, usually contains other unknown chemicals mixed within it. So basically, the youth do not know what they're smoking, and they're just doing it for fun or a new trend that they find in social media. Next, we have synthetic marijuana, which is made man-made chemicals. Could be hundreds of synthetic cannabinoids chemicals that some people may use as an alternative to marijuana. I will say that this is the most cheapest product that they could find, and it's accessible. It can also be toxic due to the process and can impact the brain in different and predictable ways compared to marijuana. Furthermore, we're going to have JUUL to explain more details about synthetic marijuana.
Thank you. And just real quick, going back to what Julia was saying, um, the fact is that hashish is the most potent form of your plant marijuana product. As they looked at concentrating the THC within the liquid form, you saw that they were able to expand it to anywhere up to 60%, 25 to 60% of THC within these products. Um, the biggest thing that we try to have is when we have conversations with folks is that this is not the same plant when we talk about just the plant itself. Of course, all most drugs that were not man-made have come from plants themselves, but this is a different product because it is more man-made through the actual oil itself and not just through the plants and through the regular concentration that you can see with THC within it. When it comes to synthetic marijuana, as Julia stated, it's a man-made product that is of various chemicals, and because of that, we're seeing an increase in calls to the poison hotline. So in 2019, when it comes to the state of New Jersey, we were the ninth highest total calls in the United States when it came to individuals suffering from the effects of synthetic marijuana. In the year 2019, the number of cases were about 6,300 of individuals who had some type of poisoning case related to synthetic marijuana. Of course, as I stated earlier, due to the pandemic, these numbers have not been able to be reported as often. So this is where we currently stand with that. Now, why is it that we're seeing this increase in individuals getting poisoned? I'll get to that very quickly, but I'll just say that these products can be purchased, as Julia stated. They're one of the cheapest alternatives to purchasing some type of marijuana product, and they can be purchased illegally at your local bodegas, at tobacco shops. Um, Unfortunately, sometimes they're packaged as potpourri. So since they're packaged in that manner, they are typically in the back. When you go into the store to purchase something, you might see some of the products in the back that might look like potpourri products that are actually K2 spice or other type of synthetic marijuana. And of course, our law enforcement are very vigilant and they're trying to, whenever they see something, to catch it. But the issue is that the folks who produce the synthetic marijuana, they modify things, they modify packaging, and they, not that they skirt through the laws, but they try to get away as much as possible with it. The the products can be used in different ways, including just smoked as original marijuana was used, or it can be mixed into the liquid and it can be vaped as in within an electronic smoking device itself. Now, there are no standards for making, packaging, or selling these products. So, as I say with a lot of our presentations, especially when we're presenting to parents of the community, is that for the most part, individuals who are packaging, organizing to sell drugs or these products, they are not looking at quality control. They're not your scientists who are looking at making sure, okay, you need a prescription medication. You know, when you go, you see the pharmacist, they're measuring everything out. They're making sure that everything down to the milliliter is the way it should be. With these products, there's no type of quality control around them. So when you're mixing them up, your synthetic chemicals can be increased in one batch. So if you have a batch, if you have a bag that you purchase within one of the stores and you use that, the amount of chemicals that you can have within that one batch can vary because we saw a video when we were doing a presentation with law enforcement where they confiscated material. And when they're mixing the drugs, sometimes they mix fentanyl with the heroin, and fentanyl is, if I'm not mistaken, 100 times more potent than your regular heroin. What happens is that some of it gets stuck at the top, and they just hit it down and they put it in a bag, and all of that fentanyl can be in that one little bag. Since it's there, people overdose, unfortunately, and some of them die due to that fact. The same thing happens with synthetic marijuana. One batch can have an increased amount of chemicals within it that leads to these poisoning issues that you're getting calls from the poisoning to the poisoning hotline itself. And they can also contain and be contaminated with other drugs as well, other toxic chemicals, such as synthetic cathinones, which, if you've heard reports of bath salts or flaca, when I first started, I thought bath salts were the bath salts, the Epsom salt that you use, but it's not that. It's actual chemical product that people use that looks like the bath salts that you use when you're taking a bath or things of that nature. As far as your physiological effects when it comes to marijuana usage, you have your reddening of your eyes, your dryness of your mouth. There's minimal to no pulmonary issues with short-term usage. So we're not going to sit here and tell you that if you, in every 100% of the cases, if you smoke once, you're going to have lung issues for the rest of your life. That may not be the case for everyone. There's not a lot of research around it. Now, with COVID-19, that might have changed due to what the virus does to your respiratory system. But before COVID, there was not much research around it. When it comes to heavy marijuana smoking over long periods of time, or just consistent marijuana smoking over long periods of times, we've seen research that shows a significant impairment of pulmonary functions as well. Along with that, you have your behavioral effects when it comes to marijuana usage. So everyone, you have your stereotypical feeling euphoric, feeling high, being mellow, being hungry, things like that. At a higher THC concentration, folks who do not use these products or have not used them frequently report some type of mild paranoia due to the fact that these products with higher THC have higher chemical within it, and it just affects your body differently. Along with that, of course, if you've used the product longer, you might not have the same effect. So you might want to feel as if you need to use more of the product to feel euphoric, to feel high. So it just increases the amount that you consume. Along with that, food consumption. So marijuana and oral THC use significantly increases your hunger and your total daily caloric intake, and verbal behavior as well. So your verbal exchanges might decrease. You might be nonverbal due to the fact that you're feeling mellow and you can't string your sentences along. When it comes to the cognitive effects of marijuana. So if you do not use marijuana frequently, you might have disrupted cognitive performances, including slower cognitive processing, impaired short-term memory, a loss of sustained concentration. The research is not out there. It's not. It would be unfair for us to say that there is an actual definitive long-term effect to your cognitive functioning from long-term use, because just the research is not available. And some of the reasons the research is not available is because still at the federal level, and Julie will touch base at the state level what's been happening, but at the federal level, this product is a Category 1 drug, which means that it is illegal for consumption and to have on you. And due to that, it's also very restrictive of the research that you can do around this product. Now, there are now states that are legalizing this product, so maybe more research can be done moving forward. But at this time, at the federal level, it's still illegal for recreational use. And I'll pass it on to Julie to touch base on what's happening here locally.
Thank you, Joel. Marijuana legislation in New Jersey. As we all know, on November 3rd, 2020, the majority of New Jersey voters voted to legalize recreational marijuana use within the state. However, it is still not legal to possess or use recreational marijuana because the governor and legislator have not agreed on all aspects to officially change the state law, which means that there's not a state law that fundaments the legal classes recreational marijuana. There's also been a confusion for people, especially for the youth, on the difference between medical and recreational marijuana. Cannabidiol, most known as CBD. Cannabidiol is the second most prevalent of the active ingredients of marijuana. It is just 1 dozen of cannabinoids found in marijuana. CBD also is extracted from the same plant as marijuana and is touted from a wide variety of health issues, but there is not enough scientific data to back up most claims. CBD is in a legal gray area. CBD is extracted from hemp, which must have an extremely low level of THC and has only been legal nationwide since the Agriculture Improvement Act, which passed in December 2018. CBD is extracted from other cannabis plants and is still illegal on the federal level, but may be legal under state law. Most states have restrictions on the use of CBD products in food and beverage. Next, we have Epidiolex. It's the only cannabis product with CBD as the active ingredient that is approved by the Food and Drug Administration. It is approved for treating 2 rare forms of epilepsy, the Dravet syndrome and Lennox-Gastaut syndrome, most known as LGS, which is typically do not respond to anti-seizure medications. CBD oil. It contains of 2 main ingredients, the compound cannabidiol dissolved in an oil made from hemp seeds and coconut. Just because the FDA approved Epidiolex, other companies are claiming that CBD medications and supplements have health benefits even though they're unregulated. CBD is being touted as a medical cannabinoid with no scientific research to back it up. Most extreme claims is that CBD oil can be used as a cure for cancer. And also I want to mention that in the stores, if you go to any vitamin shops, I started to notice that there's CBD ingredients in most of the products, such as hair products, skin products, different products that are increasing the use of CBD oil. Furthermore, I'm going to pass it on to Joel to explain a little bit more of the CBD oil use.
Thank you. And I'd say one of the interesting things, as Julia stated, is that now you're seeing CBD being touted in all different products. And a funny anecdote from a conversation we had with a senior citizen here in Essex County was that we were doing a presentation and we were talking about prescription medication misuse and abuse. And during the question and answer, somebody was asking about CBD oil, and we started explaining a little bit about it. And one of the seniors actually raised her hand, and she was very concerned, and she took out her notepad and her pen, and she asked us, now where do they sell CBD oil in ShopRite, because I don't want to pick that product up. And it was just a very funny conversation with her and letting her know, no ma'am, it's not that type of oil. You can't buy it at your local ShopRite like that. Don't worry, you're not going to get confused by it. But yeah, this product is being touted, it's being promoted as the be all end all in some cases. And I'm all for marketing and campaigning your products, as long as you are scientifically based and you're honest about what the products are. One of the challenges with CBD oil is that it's not FDA regulated. So the Food and Drug Administration does not regulate it, because smartly, it's marketed and sold as a supplement and not a medication. When you do that under FDA guidelines, when you're touting your product as a supplement, you do not have to go through regulations of all of the research, all of the science to back up what you're actually saying. So this allows companies to not have to file for review, and they're not regulated like you can regulate a regular medication product. So there's no regulation behind the safety and the purity of the supplements themselves and what they have. So even though it might certain things, even though it might say that it has certain items within it. We don't know for sure that these products, number one, have CBD as their main active ingredient at the dose that it's listed, and that we don't really know if they contain any other elements or chemicals because there's no regulation around it. There's not as strict regulation as it would be with a medication or another product. There has been some research started by the National Academies of Sciences, Engineering, and Medicine. They came out with a 500-page report when it looked at the health effects of cannabis and cannabinoids. As I stated, it's very challenging to do research on cannabis and marijuana due to the federal laws. However, one thing I just want to point out from Donald Abrams, who's a member of the committee who created this report, he claimed that it's impossible to know whether the benefits of cannabis can also be obtained from CBD alone, because CBD is just one of 400 chemicals that are present within the cannabis plant. So it was very difficult. This was a very lengthy 500-page report. It was challenging for them to find out if what they say is true about CBD because there's so many other chemicals in the product itself. So now let's touch base real quick on some prevention strategies that we can all use to support a substance-free lifestyle and just support a healthier lifestyle for our families and our children. First and foremost, parental figures are the most important aspect of things. When you look at the conversations, especially now with the pandemic, a lot of us as parents have spent more time with our children, and you can see that relationship goes a long way to making sure that you build long-term values with your children. Parents, guardians, and mentors, you're vital to the overall success of youth within your care, your child, or any other child who you might be taking care of. And alcohol and drugs are very accessible to youth within their homes, within their friends' homes, in their local neighborhoods. Uh, During the pandemic, we've seen, as data has shown, a decrease in some of this usage, but also we are still seeing some data related to alcohol and the increase in that usage. Uh, a majority of both adults and youth have said that there's a lack of positive activities for their youth. So when there's family involvement, there's parental and guardian involvement, you can increase the positive activities and increase the factors, what we call the protective factors, that can support a healthier lifestyle with your child. Family dinner time is hard for all of us. Right now, I wasn't able to have family dinner time with my family due to this webinar that we're having. But whenever you can, it's important to have it because it facilitates important and great conversations together. And remember that you always display that initial picture of what a positive role model can be in the life of your child and in our community itself. With that, I'll pass it on to Julia to give you some more insight on some more preventive strategies that we can use.
Thank you, Joel. As Joel was stating, what are some of the strategies that parents can put in practice now that they have their children at home? Being actively involved is most important. Be involved in your child's life. Research by Ashley in 2005 shows that positive parental guardian involvement decreases adolescent substance abuse. When parental figures are positive role models, children do not search for other role models who may introduce negative activities. How can you be involved? Share an interest with your child. It could be from painting, swimming, writing, any hobby that they like. Show interest in their child's abilities, activities, hobbies, schoolwork, and compliment them all the time. Teach your child how to respectfully voice their opinion and let them do so. Share personal experience. Don't make the same mistakes. Sometimes children just want to hear from you, from your perspective. Here are some tips that we would like to share with you on how to prevent substance use. Be the primary and accurate source of information for your children when it comes to drugs and alcohol. Remember that they have the instant ability to fact check you. As Joel previously mentioned, when we were visiting the schools, the high schools, and during our presentations, the youth will easily question you or fact check you. Like, how do you know that those results are real? What are the facts that you're saying? If they lose trust in you, they will get information from other sources who might promote unhealthy behaviors and activities. Some of the answers to commonly asked questions are some of the questions that you can see is, why can I use alcohol until I am 21 years old? So right now we're gonna have like a play role where I'm gonna have Joel as my parent, and I'm gonna be someone who's gonna be under 21 years old. Joel?
Yeah. So when it comes to drinking alcohol, why is the legal age 21 years old? Here in the United States, the legal drinking age is 21 years old. When you look at the research that has come out, a lot of it has to do with the fact that you're still developing. You're still a developing young adult, and it takes time for your brain and your body to develop. Also, along with that, your habits are formed more when you get a little bit older. So as you get older, you get to the age of 21, you'll have a better sense of your habits. You'll have a better brain development and body development that'll help you maintain a healthy lifestyle, even if you choose to drink alcohol when you turn 21 years old.
Thank you. Um, One of the other questions that we could get is, can you get addicted even though you only use a drug or alcohol occasionally?
As well, I'm not talking to Julia as my kid right now, but just talking to you as parents, I'll say that, as I stated earlier, there's no research saying that if you use a drug once, that's it, you're hooked on it. However, if you use a drug occasionally, as we look with the JUUL products, if you use 5 pods, by the time you get to 5 pods, there's research that shows that you are addicted to the product itself. So there's research out there that shows that if you use drug and alcohol, even if it's occasionally, you can still get addicted to it. You can still deal with a substance use disorder. Also, along with that, you need to know your family history. If you have a history of addiction within your family, if you have a history of substance use disorder within your family, that has a very increased opportunity for you to deal with that risk as well. So be aware of some histories around your families as well. Probably that's why myself, I rarely picked up alcohol when I was younger. I had my two grandfathers before I graduated high school died from cirrhosis of the liver. So knowing that they were dealing with alcoholism and seeing that kind of gave me that real life experience that I knew.
The other question, Joel, is, does marijuana use lead to the use of other drugs?
Sometimes marijuana is called a gateway drug. Uh, it might be because of the substance itself. It might be just because of the behaviors that lead you to using the product. So um, research is kind of shaky as far as you hear from some folks. Yes, marijuana is 100% a gateway drug. No, it's not. But realistically, if you're going to any type of substance to deal with life around you, or to deal with the challenges and the situations around you. It's more of getting down to the real root of the issues and your challenges, how you're coping with life, how you're coping with issues. Um, so it can lead to other drug use, yes, uh, especially if you are dealing with other issues that are leading you to substance use. But there's no research to say 100% definitely yes, marijuana use leads to you using other drugs.
And I have this question, which is most commonly asked by the older adults. Why can I use a prescription medication that is not prescribed to me?
We explained this to the parents on the call, so you can also use this as an example. When the pharmacists are there, they're measuring things out specifically for you that the doctor gave for you or for the person who's being prescribed the drug. How it affects you, how it affects your body, and it affects what you're dealing with. So each prescribed medication is prescribed specifically for a person and what they're dealing with. So if you're using it, it might have a similar effect, but more likely than not, it's not going to have the same effect on you. And if it's a pain medication, that leads to other challenges and other issues that can lead to an addiction to those pain products and leads to other substance use down the line.
Thank you, Joel. Can a person be too young to become addicted to alcohol or drugs?
Unfortunately, the answer is no. Depending on your age, if you're using drugs at a young age, unfortunately, a lot of times it's because the young individuals dealing with so many other issues and challenges around them. And since those issues compound and they're not dealt with, the person will use these substances to deal with, and they can develop a substance use disorder very quickly due to that, as we've already mentioned with other drugs.
Last question is, isn't JUUL or other vape products safer than using cigarettes?
We've explained that for you already with the data and information. The research is out there saying no, it's actually not safer than using these. They have similar chemicals, and if you're not if you're not careful, you think one pod is just one small pod, and you're not seeing that that one pod is a whole pack. If you're smoking a couple of pods a day, you're smoking way more than you probably use with your traditional cigarettes.
All right. Now we're gonna move on to understanding the systems that impact use. As was previously mentioned, prevention does not stop at your front door. You have to practice promoting resiliency to your child to help them manage interactions with other systems that they interact with on a daily basis, including your friends, community members, accessibility to alcohol and drugs, and most important is to use your sphere of influence to make changes to social cultural norms, practice, and policies. Be involved in your community is the most important thing. Lead by example. Do not serve alcohol to your children or their friends if they're under 21 years old. Moderate your consumption of alcohol, especially when you're around your children. Promote health alternatives to coping with life and building resiliency. Become a member of ADAPT and advocate for policy and programmatic changes in your area to support substance use prevention. And we also want to present the youth leadership opportunities that our coalition offers to the youth. Take advantage of youth leadership opportunities. We have available a program for your children. It's called Incorrectable Assets. These youth leaders develop resiliency skills. They expand their creativity on numerous campaigns such as public service announcements, sticker shot campaigns. They visit the liquor stores to raise awareness on underage drinking. They also have diverse social media campaigns, and they also, as they participate in these leadership opportunities, they gain volunteer experience for the college applications and resumes.
Thank you, Julia. And with that, I'll say, Amadeo, if you have anything you want to include or touch base on before we just open up for any other questions, uh, I'd say that.
Yes. Yeah. Thank you, Joel and Julia. I want to really extend our thank you from the SAC department as well as our school community. And I was very happy to hear that, you know, in the presentation, especially when you speak into youngsters. And of course, you know, Jackie and I, we most often when we have our discussion with our teens and students, we always find that the level of discussion is quite important, especially when you're trying to present issues with juuling or vaping and some of the consequences or some of the, you know, the deleterious effects. Oftentimes, they're so prone to having been told, you know, well, you're coming from a very preventative approach and you're trying to scare me. And I think, you know, that's kind of failed in the past. It's shown us that we need to be very honest with our youth. We need to let them know, hey, listen, you know, my point of trying to educate you is to really increase your awareness, your level of understanding of what you're getting involved in. And hopefully what I can tell you, you can go and, you know, especially today, we all have the opportunity of looking things up. Research is such an important opportunity for us, and we have it at our fingertips. And yes, youngsters will give you that ability, but they have to feel like you're coming across as being genuine. You're just not trying to scare them. And you're letting them know, hey, I'm concerned because guess what? These big companies, their main priority is profit. And of course, they're not going to be very honest in terms of, this discussing with you or being transparent in what's being sold to you. So that's the whole purpose, and that's the whole reason why we went to have such a jump in the smoking and the abuse. Hey, look, about 10 years ago, we've decreased the usage of smoking among teens. It was almost zero. And then when JUULs came on the scene with the vaping epidemics and these nicotine systems, delivery system, we went from almost none, having almost exterminated it, to such an epidemic proportion. And I think, having that ability and being transparent is quite important. And I was so happy to hear that you and your organization had the same experience, because Jackie and I, we as SACs, we struggle with that because we want to come across as being genuine, honest, but at the same time, it's our duty to let them know it's not safe. Just like one of those answers and questions that, was presented by Julia, is it a safe alternative? It was meant to be an alternative to get you to stop. But guess what? It's so much more addictive that you're not stopping. And I know people, I personally know people and teens and students that they attempted to do that. And guess what? They not only continue to smoke in the physical, but now they have another level of addiction to the JUUL because they have candy, watermelon, vanilla, pineapple, such an enticing aromas. And that's what has them hooked. And I think it's just a travesty by these big companies to really, they knew what they were doing. They were targeting our teens because they knew that, hey, if I make it so enticing, then I can get you to use my product for years to come. And I think, and I want to thank, again, your organization, because you're very honest and truthful. And you guys do your research, and you're on the grounds in terms of, speaking to not only parents, but teens. You're across the board, and you're even, at the legislative level where you're talking to lawmakers and letting them know and understand what the experience has been from the ground up. And that's what we struggle on a day to day. And you know what? When this, medical marijuana came on the scene, that's a battle that we're trying to get ready now, because again, just as relevant in your question and answers, look at it in terms of alcohol. It's been legal for 21 and over. It's legal, but look at the amount of medical complications and deaths that arise from it. And so the marijuana itself, yeah, there's some medicinal purposes, but we have to be careful because we're dealing with, you don't know what in terms of the genetic coding that's already predisposed, that I have addiction in my family as well, and I'm very cognitive of it, just as you. And I was happy to hear you, because it's a human experience, and what you bring to the table and what you're sharing, your genetic code. And I think we as parents, and that's the opportunity that we're trying to afford as parents, is that, hey, let's be aware, speak to your kids, let them know what's out there, and what is your level, or what is your expectation, without trying to put fear into them, because that doesn't work. Fear only works for a few seconds, and then they walk away and they see their friends having a good time and enjoying. And you know what, y'all, I've seen those YouTube videos on how to, they have competitions on vaping, who makes the biggest vape circles. I was astonished. And I have a 10 and an 8-year-old, and I'm like, wow, these guys, I have to be careful, because these guys, they're always on the internet. I mean, I wish I could patrol it 24/7, but they're on there, and that's where they're getting their information. They're getting the info. And what type of info? It's a skewed type of information. And I think, just what we're doing tonight is just, we're not scaring parents. We're saying, please take the opportunity, look out there. If you're going down to the bodega, and I have a few around here, I make sure I go in the back and I'm like, okay, what's over here that my kids will one day come here to get that, gallon of milk? What are they going to be enticed by? I need to know that. Because yes, that K2 and that Flakka, you see folks strung out on that stuff. You see them strung out. It's all ploys of saying, hey, we're going to get a product that's out there cheaper, and yes, still gives you that same euphoria. So it's an awareness. And again, I can't say enough to say thank you, because you guys are presenting it in a down to earth, very experiential way. And I want to thank you. I want to thank Julia and absolutely your organization, because that's what we need. We need more of this for our parents.
Thank you. We truly appreciate that. Just one quick another anecdote real quick that goes back to one of your points, and then we have a question that I also want
Sure.
to get to. So with the whole, before the marijuana was legalized in 2019, pre-pandemic, uh, the there's a summer internship program that takes place that we usually do a presentation with it, and it was an interesting conversation that we had during that time, because once again, as we stated, everybody has this, and the
I
kids
know.
can go. So um, somebody was presenting before me, and they were having a conversation related to the legalization of marijuana, why it's bad, things of that nature. And then when I came up, well, I saw some of them talking in the back while I was waiting to present, and some of their looks and all of that. And
Mhm.
so when I came up and I started having a conversation, I said, I heard some of you guys back there talking, and I heard somebody talking about the legalization of marijuana, the fact that it should be legalized because people need it as medicine to be helped. And I just asked a question. I said, "Isn't it already legal in a medicinal way?" And the kids looked at me, and I said, "That's the issue. You see, we don't know that it's already legal for medical purposes. What's illegal is for recreational." Now that was pre what happened in
Right.
November. But during this conversation that we were having, we had, it was a young lady who was researching, and she was grilling me, asking me some questions related to it, related to the social justice aspect of it as well. And I asked her a question. I said, "Do you know who Harry Anslinger is?"
Mhm.
And she looked at me, and I said, "Do your research. He was the first person who, if I'm not mistaken, who was the founder of the FBI." And I told him straight up. I said, "I teach a college course on drugs and alcohol. So I know my research. I know for a fact that in through the system now we're hearing a lot of it now after these conversations I had with them, but a lot of the laws that were in place, especially a lot of the drug laws, were racially based, and they cause a lot of harm in our system." And when I had that conversation with them, their eyes perked up and they realized, oh crap, okay, well, uh, this is somebody who knows their stuff, and they're not just. So I presented to them in a way where, as we've spoken about today, it's just more of a factual conversation. And to go back to one of the questions that was asked is, how do you handle a question from your child saying, "Have you ever smoked marijuana?" And honestly, that's a challenging question, and it's
Yeah.
based off the comfort of the parent. We're not going to tell you how to have conversations or how to have dialogue, because it's based on your comfort. If you want to have a conversation and state uh, of any use of substances that you've had in the past, or anybody else has had in the past, that's up to your comfort level. And what I would keep it, if you're not comfortable, of just saying, "Look, right now I don't want to share this information with you, just because I don't want to talk about any substance use in our family, but I do know individuals who've used substances, and this is the challenges that we've seen from it." But kind of starting to guide conversations into
Yeah.
more of a conversational way where it's, "Look, I just want you to trust me and trust the information that I'm giving you. Um, just make sure you have the factual information." It's hard. It's hard to have these conversations. I'm kind of lucky because I have a 12, 13, and 17-year-old, so older level of kids. So we have these grown up conversations. But I know that Jackie's also on the lines. I don't know. I know she was jumping between the two presentations. So
Yes.
Jackie's here. I'd love her to also jump in and chime in.
Hi, good evening, everyone.
Hey,
My
partner.
name is Hi, Miss. My name is Miss Headlam. I'm one of the student assistance counselors. I just wanted to jump in and provide another answer for Miss Bryn regarding that. So a way to handle that also is, I agree with Joel. You do not need to disclose anything that you have done in your past. However, what I would discuss is that the different level of potencies between marijuana back then and marijuana now, the different ways that they're smoking it, the THC levels. It's at a extremely 3 to 4 times higher, probably more than that rate right now. So the level of THC that would enter their body and the way that they're consuming it, whether it be via vape or bong or whatever other electronic device that they're using, they're heating it up at a different level. So the amount of THC in their body is going to be increased. So I would come at it from that standpoint if you felt comfortable. Um, just because the potency is different. I think sometimes when I've had conversations with teens, that's been something that they did not realize. They're over here thinking that it's all the same, and it is not the same. It has definitely the THC and marijuana plants has, I don't know how, but it's definitely gotten
Mhm,
stronger throughout the
mhm.
years based on the different forms of extraction.
And also, thank you, Jackie. And also, just as a counselor, Ms. Bryn, it's okay for you to, to not be comfortable with that question and letting your child know. But because the main goal is that you want to offer a real down to earth insight. Your kids need to know that you're human and you're not just attempting to scare them to not to use. Because as I said, they're going to see their peers and their counterparts that bad things are not going to happen to them and they're having fun. So that's why you got to, again, from my own personal experience, I chose to say and speak to my children about some of the dangers, and I want them to be uh, feel comfortable to speak to me in terms of wanting to know what are drugs are bad and why they're bad. I let them know why I think they're bad, and also why I've seen, some of these effects. And so I'm comfortable. That level of comfort with me is there. But it's okay also for parents that aren't comfortable to say, you know what, I really care about, it's so important that you're asking me this, but I want you to get a good, clear understanding of even why you're thinking of doing it. And letting them know that you're human and then your interest in their inquiry is paramount. And we see that often in counseling, that's what's lacking, and that's what drives most of our teens to to get the advice from their friends, where they're more coerced and they're more enticed. Whereas, come from us as parents, we're saying, hey, look, I appreciate that you're asking me. And yes, I did use, if you're comfortable, if that level of comfort is there, or no, I haven't, but that doesn't mean that, I'm not concerned about you. And so developing that relationship is really important, because yeah, it's a gateway drug, but there are so many others, I mean, look at nicotine, the most addictive, substance known to man, a lot worse, and it does more holistic and systemic damage to a lot more than any others. So being honest and truthful, I think, is really, that's the way to go, I think, my experience.
And I'll add also that sometimes some of our parents have spoken to us about the fact of sometimes the not the pushback, but the counter argument from some of our youth is, oh yeah, but look, during Woodstock they were using it during
Of
Woodstock,
course.
so they were using it during Woodstock. Why is it such a problem now? You could say, you go to Woodstock now, or you go to Coachella.
That's right.
Things have changed. Things have evolved over time. So
Yes.
when you're talking about the what Ms. Hedlum has stated
Hmm.
earlier, the potency has changed over time of the drug. It's not just a plant anymore. It's more potent. The THC levels are in it. It does more to your body now due to that. There's more chemicals mixed. As Ms. Amadeo has stated earlier, folks that are trying to increase their profit margins, not just corporations, anybody who's
Right.
in a business. So when they're packaging these products, they're adding other things in it to increase the bulk of it, increase how it looks, to expand their product and expand how much product they can use. So just be aware of that. Be aware that you can counter with that discussion of things have not stayed stagnant over the past generations. They have
Mhm.
evolved. So therefore, the usage of these products has evolved, and what's within them has evolved as well.
Yeah. Excellent. Thank you, Mr. Torres.
And just in case, Ms. Headlam did include a tip or a website that you can check out. We'll wait a couple seconds, see if there's any other questions as we wait. But we'd also like to just let you know you can always stay connected with us. We are available through our social media channels, and we'll make sure that we pass this presentation on to our partners at West Orange High School so that they can share it with their families as well. This video will be edited, of course, to not include any personal information of anybody. It will be edited and posted onto our YouTube channel. So if you search Essex Adapt on YouTube, you can definitely find us, subscribe to our page. We have a lot of webinars and information available as well. And also subscribe to our social media channels on Facebook, Twitter, Instagram to get more information or details on the work that we're doing here in Essex County to be more involved with the coalition. We're always looking for more coalition members, volunteers, and your level of volunteering does not have to be extreme. We have a simple thing where you're a volunteer just by receiving our email list that we send out every week with resources and information. Or if you want to be actively involved where you become a leader within our committees, you can do that as well. There's no requirement of how much activity you need to do as a member. We want to make it as inviting as possible to our families because the information is out there, the resources out there, and we just want to make sure we share it. This is our contact information, so you can definitely touch base with myself or any of my staff. I am the senior manager, but we also have our partners who work in various aspects and various levels. So thank you so much. If there are no more questions, I'd pass it to our partners at West Orange High School to close it out, and we'll say our goodbyes.
Thank you, Joel. We appreciate it. And I also want to thank community members and also West Orange, our community. The whole purpose is to bring a lot more of these informational and resources available. Of course, we encourage any parents, if you have any concern on any issue that, that you're dealing with your child, please reach out to the Student Assistance Department because we're there. Ms. Hedlum and I, we will absolutely, do our best to make sure that we reach out and secure whatever information or resources that you may need. We're always there for you. We just want you to know that. And without any further ado, Ms. Hedlum, you have any lasting parting comments or statements?
Just thank you all for your participation tonight. If you need anything, as Amadeo said, Mr. Churchill, please reach out to us. We thank you and have a great evening.
And Joel, I want to thank your family for we shanghaied you from dinner time. I want to thank you for that. I wrote it in the comment over there. I want to make sure that your wife, she gets my appreciation. I really, I'm very sympathetic because I love family time and dinner time with my boys.
It's the work is important as well. So
yes, and I feel that as well, and that's why, sir, I want to thank you and your organization.
Thank you guys for being great partners. Julia, if you have any closing words.
Oh, thank you very much, everyone, for the invitation. Just follow us on the social media. We have always trying to promote new initiatives for the youth and also collaborate with the community. Thank you again.
Thank you and good night, everybody.
Good night, everyone.
Have a good one.
Have a safe one. Thank you.